Hello everyone, I am back with another video. This video is just going to be me giving you some friendly advice for when you start clinicals. I post on Instagram a lot about sometimes what I overhear students and residents and how I hear them talking to preceptors and doctors and anesthesiologists, and I'm like, my eyes get big because I'm like, what? Why are you talking to them like that? Why are you speaking like that? So this is just going to be some friendly advice for you if you're starting clinicals. I think it comes down to social awareness, picking up on social cues, and being humble and having respect and being able to show all of that while learning. So it can be challenging every day, dealing with different preceptors and personalities and surgeons and the stress of taking care of a patient to the level that you are expected to, and preparing for the long clinical day and, you know, figuring out what you should know, what you shouldn't know. So the first thing I will say is you aren't going to know everything. However, you should prepare extremely well. Now, you may encounter a preceptor who treats you like you should know everything, and that happens, but all you can do is know that you prepared as well as you can, and the rest will take care of itself. If you continue to play into the, oh my God, I didn't know that, your whole day is just going to spiral downwards. So that's why preparation is very, very important. Prepare the night before if you can. Make a decent care plan, which I'll make another video about. You want to show up to clinical prepared. Prepared also means the things I just talked about, but it also means knowing or having some slight idea about where you're going, which rooms you're going. So setting up some type of orientation the day before, or going on your own and figuring out where you're supposed to be. Do you have access? You should definitely figure out if you have access. Are you supposed to be being able to get certain drugs on your own? For example, are you able to get narcotics out on your own? Should you be getting those out? Did you call your preceptor before? So I'm also going to do a video about talking to your preceptor and leaving a message, because sometimes a lot of people have anxiety about that. So I'll give you my little foolproof way of speaking to them. So about being humble. To me, being humble doesn't just mean like not bragging about yourself. To me, being humble means knowing your role, knowing your place. As a student, registered nurse anesthetist, you are no longer in the ICU. You're no longer there. You are now a student, and you're a student of the anesthesia game. Anesthesia will humble you by itself. It will. You can think you have read everything, every line in the book, and you know it front to back, but when you step into that OR, it is a whole nother ball game. Realize that you are no longer in the ICU running a propofol drip. Yeah, you may run a propofol drip in the OR, but it's just not the same. You are learning how to manage a patient from top to bottom, every breath, every heartbeat, every blood pressure, every wink of an eyelash, every little movement, and also monitoring what is happening in the surgery. So if you, for some reason, think that you in the ICU and you reading some things out of a book has prepared you to walk into the operating room like your ish doesn't stink, you have a world of hurt coming for you. So I suggest that you just kind of take it down some notches and realize that you are a student, and that it's okay to be a student. It's okay to not know everything. In fact, the feedback that I get sometimes from preceptors is, I'm glad you're not a cowboy. I'm glad you asked me that question. Humble yourself. It's okay to not know it all. Being respectful. Introduce yourself to everybody. Look them in the eye. Introduce yourself. My name is Aisha. I am a blank year SRNA. Nice to meet you. If they ask you a question, if they ask if you have any questions, come up with some type of question. Because if you say you don't have any questions and then you go into the operating room and you're asking questions, they're gonna be like, okay, I thought I just gave you the opportunity to ask some questions. So, have a conversation, if they're talking to you. Now, on the flip side, you need to have really, really good social awareness and be able to pick up on social cues. In a conversation, or if there's kind of like an awkward lull, one thing that I do is I just excuse myself to go to the bathroom or take a break, get some water. And usually they're like, oh yeah, go, definitely. You don't need to sit there and like try and listen into personal conversations. Not the time. Who's talking to you, if they're in the little corner and they're, looking on their phone and they're talking about what they ate for dinner last night and no one is talking to you or looking at you, or they moved away from you, that's not your time to go and, socialize. Rather recently, I have come to know that not everyone kind of was trained or was raised in that manner. That's how I was raised. I was raised that you speak when you're spoken to. If there's something outrageously wrong, of course you speak up. But otherwise, you are kind of just doing what you're supposed to do, minding what you're supposed to be minding. Being respectful means I'm saying yes ma'am, no ma'am, yes sir, no sir, until I'm told not to. A lot of times people will laugh and they'll say, don't call me ma'am or don't call me sir, just call me by my first name. But until you tell me that, that's what I'm doing. You could have read every single textbook and memorized it from front to back. But your patients don't read those textbooks. Your patients don't go to sleep saying, I am going to act exactly like the book said I would. Your patient's comorbidities, their age, if they're sick, or how about this? Or for no reason at all, your patient will not always act like the textbook says it is. So when you're in clinical, you need to learn from those who have that experience. Be teachable. Be able to soak up the wisdom, the knowledge. Be able to be critiqued. Criticized. I was always told to listen to what people are saying rather than how they are saying it. Some people may raise their voices. Doesn't bother me a bit. You may go home and it may bother you all day long, but that doesn't mean you return that same favor. You should not be raising your voice at anybody. You should not be throwing things. Yes, I've heard it. If someone tells you that you are wrong, even if you know in your heart and soul that you are right, whatever, nod your head, say thank you for that critique, and you do whatever it is that they told you to do. Now, of course, if it's not safe or you don't feel comfortable, you can speak up about that. But I've talked to a few people and overheard a few students sometimes like really voicing strong opinions about things, and I'm like, you don't really have room to have an opinion at this point in time. You are a student. You are there to learn. Until you are at the point where they're kind of like letting you fly, you should be doing things under the suggestion from preceptors and what they like to do. Because after all, you don't have your nurse anesthesia license. They do. They've been doing this on their own. They've passed their boards. They've finished school. So even if you think for some reason you read about some ventilation technique that's new and new research, it is not your time to sit here and start to pull and name drop and resource drop when someone is not really asking you a question. People may yell. It's a stressful environment. The surgeon is trying to operate. They may be missing supplies, or the lights go out, the patient is crumping or decompensating, and they're missing supplies, they're short on something, they're short-staffed. Stress creates increases certain levels of anxiety and makes people sometimes act abnormally than what they would usually act, or how they would usually act. Again, just listen to what they are saying rather than how they are saying. I highly suggest taking lunch or taking a break when you are offered. You don't know why they're offering you the lunch. Just take it. No need to figure, you'd rather nothing. You just accept the break and you go and take it. Because I'm thinking about it now, like it could be just they want some breathing room, or they want to do some things with their patient on their own. You don't know what the reason is. But anyways, so all in all, being prepared, being humble, being respectful, and I think if you have all those things, your clinical days and your experiences with your preceptors will be good. Hope this video was helpful. Definitely give it a like, subscribe, and comment down below, and follow me on Instagram at aishaSRNA. Thanks, guys.